loose runner stuff. 'Cause we'll
Okay.
never hear the end of it. That's the box right there.
Okay. Okay, you guys gonna accept Miss Maria.
Maria.
Okay. I think, is it four? You need a couple more?
We need
Two
two
more
more chairs.
chairs?
Three.
They said they were gonna bring up. Let's see who I can get to bring up. And I didn't get his name. Okay, so you guys need two more chairs, right? Are we able to get two more chairs? High chairs? Three? Three more chairs? Or do you guys want to sit here in the front, or do you guys all prefer to be on the stage? Okay. Because I don't know if they're going to bring any more chairs. But even if you don't have to, where's Noel?
Noel's coming.
Okay. Are you guys in order?
That's what we're trying to do. So it's Nicole,
Yes. You want to
Abby, and then Noel.
Oh, okay.
And then Maria.
How do we change? Let's
Okay, so
do.
we
Okay,
have a
yeah.
clicker.
Okay,
So you just point it
Okay.
to the.
the one on.
Okay, why did
Oh,
it
the
do
one
that?
down.
So yeah, one down. I'm sorry, one down.
Can we use the enter button? One down.
Or
okay.
you can hit this.
Okay.
It's up to you guys.
Okay.
No more chairs.
Arrows.
Okay, because we'll start in.
Yeah, just
We're
go
about
here,
to
yeah,
start
yeah.
in like a minute. If not, they can sit here.
Because I don't need a chair after I
You don't need a
present.
chair?
I mean, after I present, I can give it to someone else.
Yeah, because who speaks first? Maria.
I'm just introduced and then she goes. So,
Oh, okay.
yeah.
So the panel who's really speaking should take up these chairs,
Yeah.
right?
Yeah.
And how many is that? Four speakers?
No, all of us.
I know, but you're
No,
just
I go back.
introducing.
I'm part of the
She's
panel.
still gonna.
Oh, yeah, yeah.
Oh, okay. So we're trying to get the chairs.
Yeah, so
we'll get
it's
the
all of
chairs.
us, yeah.
We're trying to get 3 chairs. They need chairs because they need their whole panel. Chairs, everything.
No, we just wanted just two more of these ones.
Yeah, they said 2. Okay. Yeah. No, you guys don't want the lighting down a little bit, do you guys?
Well, can
A
it
little
be
bit.
for the presentation? Like
Yeah.
this?
Yeah, like this
because
right here.
It is so bright.
Okay.
Oh, okay.
Right, I got you.
Yeah.
This right here.
Oh. No, that was like too low.
That was too low.
Yeah. Yeah.
It's coming.
Yeah.
Okay. So
Okay, awesome.
when
Thank
we
you.
do start, being that we are running behind now because we're waiting on the chairs, if you guys can like
Speed it
Like
up.
speed it up.
speed it up
Got
a
it.
little.
Okay.
Say less.
because we're waiting on you guys too. It's kind of like no.
No.
It's just gonna dim the light. Hello, everyone. We'll be starting shortly here. Thank you for your patience. Or you want to stand?
Okay, we can get started.
Three. So if they say we can start and they'll stand if they have to. It's fine. We got it. It's okay. So we can use these.
We got it. Perfect.
All right, ladies.
Okay.
There you go. Perfect.
Laura, you're before me.
So you guys will go in order. There you go. All right, ladies. Okay. Hello, everyone. Welcome today to the Medicaid Fall Fair. This is for Amerigroup, and today I would like to introduce our host, our main speaker, Miss Maria. Thank you.
Good morning, everyone. Can I get a good morning? Good morning. Thank you. I hope you got some coffee and some water in that break. And we have a great presentation coming up. Again, we are Amerigroup, as you know, one of the 3 CMOs for the state of Georgia. And we're going to be presenting of a suite of information. So we're excited. And our first speaker will be our Health Equity Director, Nicole Williams.
Hello, everyone. As Maria stated, my name is Nicole Williams, and I am the Health Equity Director for Amerigroup. And today, Mercury retrograde. So anyways, I'm here to talk to you today about social determinants of health and how we manage them for our memberships. But first, I'd like to talk about what social determinants of health are, otherwise known as SDOH. SDOH, as you can see on the screen, there are 5 pillars that make up SDOH. SDOH is something that no one escapes. It's where we live, it's where we work, it's how we worship, it's everything that makes up who we are and the environment that we live in. So how do we identify SDOH? We identify SDOH through our community partners, through our state partners, and through our membership. And we address these needs through the initiatives that we create. We also have to identify social risks and social needs. Social risks are things such as high unemployment, living in a crime-ridden area, and social issues. Social needs encompass food, housing, transportation, education, and financial challenges. And we identify these needs through speaking to our members and asking them directly, what are the things that impact them? If we find that they have needs, then we make referrals to the different community resources for them. And in 2024, we made over 21,000 referrals for our members, and we were able to close over 5,000 loops. Some of the ways that we screen our members, there's actually a 2-pronged way that we screen our members. First, internally, through our pharmacy managers, our case managers, and through our community health workers. We use our internal resources and databases to screen our members and to collect the data that we need to help serve them, and then also through our vendor relationships. Our vendors collect SDOH needs as well, and then through our provider community. We maintain close relationships with our providers. Our providers will oftentimes bill Z codes that indicate social needs, and they also conduct their own surveys about social needs and social determinants of health for our members. And so once we collect all this data, how do we use it? Well, we track and we trend it. As you can see on the screen, there are various ways that we track and trend our data. The reason why we have so many different ways to track our data is because it creates a story. And this story shapes how we create our initiatives and how we communicate with our members and our providers in our community. And so we use this data to improve upon existing initiatives and to develop new ones. We use this data to enhance our relationships with the community and to strengthen our relationships with the state. And so this is just an example of how we use the data. We use this data to create initiatives that address food, housing, healthcare, and even behavioral health needs. We use this data to help our members deal with their short-term needs and to also create initiatives that will follow our members throughout the course of their membership with Amerigroup. And now, I will turn it over to Noelle Gallagher to talk about provider complaints.
Hey, good morning, everybody. Noelle Gallagher, Director of Provider Relationship Account Management for the state of Georgia. And today we're going to talk about the provider complaint process. Claim payment reconsiderations is your initial stage, and we do allow those through the provider website in writing and verbally 90 days after the explanation of payment has been received. The second level would be a claim payment appeal, if dissatisfied with the reconsideration outcome. And their third and final step would be the administrative law hearing, and it's an external review process available after exhausting Amerigroup's internal dispute process. Those requests must be received within 15 days of the claim payment appeal decision. To date, our highest complaints are related to provider demographic errors, provider loading delays, erroneous authorization denials, and claim denials, incorrect payments. The improvement plan that we've put into place is to enhance our provider system, to reduce the amount of loading errors, and to work with DCH to improve the data accuracy that comes over on the 7400 file. Resolution will include increased provider loading accuracy and a decrease in claim payment issues. Related to our call volume, for quarter 1 through quarter 3, we have accepted almost 46,000 calls under Georgia Families and 876 calls under Georgia Families 360. Our complaint volume total of 96 for quarter 1, quarter 2, and quarter 3 of 2025. Those are actually decreasing. We'll move on to how to contact your Amerigroup provider representative. We have a dedicated team that manages and responds to inquiries via our web form process, which can be found at amerigroup.com. Outreach via email or phone will be redirected to provider services. Next, we'll look at how to submit a claim payment dispute. We do accept those verbal, online, and written considerations and appeals. For a non-claim related provider complaint, we do accept those in writing at the address on the screen, and we do send acknowledgement letters to the provider within 10 business days of receipt. We've also added our county assignments as well as the provider relations representative by county, system, hospital, and facility. These are some really hardworking associates that actually report directly to me. We are spread across the state as well as contiguous counties in Florida, Alabama, North Carolina, South Carolina, and Tennessee. All right. Next, I'm going to turn it over to Maria for Georgia Pathways Program.
Thank you, Noel. Hi again. My name is Maria, and I'm the Director for Marketing and Community Relations. Today, we're going to talk a little bit about Pathways. As you all know, the Georgia Pathways program had some changes effective October 1st. So we're going to talk about those. So starting October 1st, the Georgia Pathway members have now a copay for some of the covered benefits. These copays are in alignment with all the Georgia Medicaid copays already in existence. Of course, we want to clarify that members under 21 do not have any copays under Georgia Pathways. As we know, Pathway goes from 19 to 64. So those members who are 19 and 20 do not qualify for the copays. And of course, any members that cannot pay their copays cannot be denied service for a covered benefit. We have a lot of information available in our website. You can visit the provider website where we added a banner message. We also added some FAQs about the updates of Georgia Pathways. We also have all those FAQs available in our table today, so you can go and grab it as well. There's a lot of good information, so you can go on the website and see. That's a screenshot from the website. Here are the copays. As I mentioned, they are all in alignment with the current Georgia Medicaid copay, and you can find this in your provider manual that is available in the provider website. So this is a snapshot of that copay amounts. Another change that was effective October 1st for Pathway members is the change in coverage to be retroactive coverage. This is an example of how the new coverage works. So it's now, it goes back to the effective date being the first month where the member apply for Pathways. So that changes on how it used to be before that. New members will be covered for fee-for-service retroactively, and then we'll start with CMO 2 days following that eligibility determination. And there's a specific timeline assisted there. We want to highlight that there's no assistance in paying for prior months' medical bills before they were enrolled in Georgia Pathways. This timeline is also available in the FAQ materials that you can find on the website and in our table today. As provider, we want to ensure that you're following some of the responsibilities to meet our members' care. Some of those are, of course, complying with all the federal rules and the state rules. As I mentioned before, Georgia Pathway members who cannot pay their copay cannot be denied covered services. Providers are required to adhere to all the access standards in the provider manual. We have a cultural competency training also available. And we have a lot of training and resources available in the provider website. So within the provider site, there's a provider academy where you all can take trainings and resources available there. If you have any questions whatsoever today, please visit the table. We have our table in the break room, and then we also have the claims table. Some of the provider materials that were updated was the provider manual and the FAQ and the website. As I mentioned, that's a screenshot of the provider manual. It's a specific manual just for Georgia Pathways. So it's a separate manual than the Georgia Medicaid, and the FAQ was updated as well. Thank you. I'll turn it over to Lori.
Hello, good morning, everyone. My name is Lori Chalk. I am the Director of Operations. I will be presenting on behalf of our prepayment review team, which is also known as our Special Investigations Unit. If you have questions, if you do not have questions, if you are currently a provider that is on a prepayment review, you may go to our claims table, as Maria mentioned, for questions, or you can outreach to your special investigations analyst via your notification that you may or may not have received. Okay. It's trying to get away from me. It wants me to get to the end of this presentation. Okay, so just a little bit about prepayment overview. Prepayment refers to the evaluation of medical claims and supporting documentation. Amerigroup has a certified professional coding team that will review all claims that's currently under prepayment prior to claims payment and/or denial. The goal within prepayment is to verify that the submitted services were provided, that they were appropriately coded, and/or it is supported by the medical records that were submitted. This initiative helps to prevent improper payments and also to include fraud, waste, and abuse before the funds are actually dispersed to the provider. The actual prepayment review overview process entails the provider initiating the request by submitting any claims or documentation that's under prepayment review to Amerigroup. The provider or facility will include all the appropriate medical documentation to include medical records, supporting documents, your claims, billing, coding, and the appropriate documents to support that. The next step within the process will be that claims are reviewed, and if the medical records and supporting documentation is not provided, your request will be denied. Providers cannot, and again, providers cannot appeal being placed on prepayment review, but you can appeal the claims that may or may not deny. If you don't agree with the payment, or if you definitely don't agree with the denial, make sure that you are submitting the appeals as appropriate. The last step in this process is providers will receive a notification letter prior to being implemented, which would provide the information for the analyst that's currently reviewing your case. You should have outreach information to include their email address and/or telephone number. Okay, so we have a prepayment review overview. Working through prepayment review, that's the tongue twister. Documentation can be sent electronically via Availity or dropped to paper and mailed in. Providers will receive review result letters as they submit claims, notifying them of approvals and/or denials, including the rationale for the denied claims. The next step in the process is to review common issues that providers may encounter when submitting their documentation. You want to ensure that your visit documentation is included within your claim form in order for your review to occur appropriately. Ensure that you are accurately completing and filling out your claim form submitted with your recorded documentation for the analyst review. That's very important. They take all of the information into consideration when making that final decision, so it's very imperative on the provider's behalf it prevents a delay in payment, but you would always want to ensure you're submitting the appropriate or the requested documentation that the team has requested of you. Removal from prepayment review. The aggregate of claims reviewed must meet an 85% pass rate before the provider can be considered by the team for removal. Providers who have an error rate less than 15% based on claim line items, not the overall claim, they're looking at it line by line, for a period of 6 months will be considered for review. The providers will be notified in writing at the end of the date of the prepayment review. Okay, so we have a few performance metrics. This is reflective of our Q1 and Q data for 2025. Our SIU team has reviewed a total of 87 providers and a total of 14,622 claims. Again, if you have any questions, if you're currently on prepayment review, please feel free to reach out to the analyst that's listed on the notification. If you have questions today in regards to claims that are denying for any other reason outside of prepayment, please be sure you're visiting our claims table. They're ready to assist and help and answer any questions. Okay. So next up we have Lakeisha Williams. Thank you.
All right, good morning, everyone. My name is Lakeisha Williams, and I am the Director for Behavioral Health Services at Amerigroup, Georgia. And so today we're going to talk about autism spectrum disorder supports that are available via Amerigroup. But before we talk about those supports, it's important that we understand exactly what autism is. And so autism spectrum disorder is a complex developmental condition. It involves persistent challenges with social communication, restricted interest, and repetitive behaviors. While autism is considered a lifelong disorder, the degree of impairment and specific challenges do vary by individual. The prevalence of autism continues to increase in the U.S. As of 2022, the amount of citizens in the community was about 1 in 44 people that would be diagnosed with autism. As of 2024, it is 1 in 36 children are diagnosed with autism. And so you can see that those numbers continue to grow. We do offer lots of support for members in our community who actually have been diagnosed with autism. Some of the things that we offer include an actual dedicated autism or ABA case manager. This case manager works with families who have children or any family member who's been diagnosed with autism. We also provide support to our provider community. So those providers who are actually delivering support to those members in the community, we provide training for them as soon as they are contracted with us about how to best support our members, also understanding how our case managers can assist them in supporting our members as well. We also do and provide an incentive program for our providers to deliver the type of care that we know increases quality among those members who have been diagnosed with autism. So those providers who are able to get the assessment completed within 30 days or those providers who are actually having sessions with the family involved, we consider that to be high quality. And so as a result of that high quality, we offer financial incentive for those providers to continue to increase the likelihood that our members are receiving the best care possible. One of our most successful initiatives as it relates to support is our Autism Concierge program. And so this is a digital platform that's aimed to support parents of children between the ages of 0 to 4. So this is a preventative initiative. The member does not have to have a diagnosis of autism yet. This is meant to make sure that we are being as proactive as possible before there's even an autism diagnosis there. We also provide support to those family members who have children who have a confirmed diagnosis. There is bidirectional program support for participants who engage in the service. We have had over 100,000 enrollees in the program. And of those 100,000 who have enrolled, we've had a 99% retention rate. So they believe it to be effective as well, and a support of those members who have joined in our Autism Concierge program, they have reported to us a confidence from 52 to 75% in being able to care for their child. In addition to that, we've seen a 24% decrease in inpatient visits as a result of this concierge program. So what we're going to talk about today includes some specific case examples of how we've provided support to members who've had a diagnosis of autism. So our first case study includes an 11-year-old male who has complex medical and behavioral health history. This member actually not only had a diagnosis of autism, but also at birth had substance exposure. There was also a frontal lobe injury, and in addition to that, this member experienced frequent seizures. There was also pica behaviors, aggression, defiance, animal cruelty, self-harm, and severe memory issues. And although this was an 11-year-old, this member was functioning at a 5-year-old level. Some of the interventions that had been tried included this member having to go inpatient over 14 times since 2021. This included 2 psychiatric and 2 medical residential placements. So that includes this member being not with their family, not in their home, not in their school, but in a completely new environment over 14 times. In addition to that, there have been ABA supports that were provided to this family, including therapy, after the member would be discharged from the hospital. As a result of that therapy, there was some success, and the member was able to be stabilized for about 6 months in the community. However, after that time, due to some changes in the environment, the member had additional hospitalizations, and medication changes had to be made in order to increase the stabilization. The member was placed on clozapine 200 milligrams, which is a pretty strong drug for an 11-year-old and requires frequent monitoring by a psychiatrist. So what our case manager did to provide support for this member was work in the community with the family to identify a specialized placement which included an educational program that also allowed the member to go to clinic-based ABA therapy twice a week, receive ongoing care from a psychiatrist, a neurologist, and that continued support from the ABA providers. So making sure that the totality of that member's health was addressed by both physical health, behavioral health. In addition to that, the case manager worked very closely with those parents who were involved to ensure that there was treatment planning and execution of that plan by all of the providers that were there. This really helps to eliminate some of the stress that the family has to endure by all of the hospitalizations, talking to so many doctors, really having to reshare all that's happening with that member. There was coordinated communication by the case manager to the care team, who also identified local supports in the community. Even with the support of Amerigroup, some of the challenges that were continued for this member was continued denials from providers who didn't feel like they could meet this member's needs. So often, when he would go to a hospital to try to get treatment and try to find longer-term placement, those facilities said, no, we can't provide support for this member, or maybe he had already been there and they didn't feel like they could continue to provide support. So a lot of the work had to be done in the community. The case manager worked to make sure that despite this member's diagnosis and the medical challenges that he had, including seizures, frontal lobe injury, and the substance exposure, that he still received services that were equitable for him. That included having 24-hour support in the home, as well as specialized medication management, because as we talked about, this was a member who needed additional review due to the amount of medication that he was taking and required frequent monitoring. However, this member has been able to maintain in the community for a significant amount of time. Our second case study is very similar. It's a 16-year-old male who was diagnosed with Phelan-McDermott syndrome and autism level 3. Some of the challenges that this member experienced included communication difficulties, also behavior management. One of the things to note about Phelan-McDermott syndrome is that members often regress. And so while the member was at one point able to ride a bike, able to care for himself, he regressed to the point where he wasn't able to walk, he wasn't able to do many of his own ADLs without the assistance of an adult. This member also had multiple hospitalizations and needed residential treatment due to mood instability and aggression, which we could all understand when you lose a lot of your ability to care for yourself. Our care manager facilitated access to crisis stabilization facilities and coordinated care with the member's PCP, as well as other specialists in the community, to help manage the physical health component related to the Phelan-McDermott syndrome. This member was also transitioned to a specialized facility, and post-stabilization at that facility, there was regular communication with the family to help not only the member adapt to treatment, but his whole family system. Our family-centered approach included advocating for family counseling and guidance for managing the member's aggression and mood in a single-parent home. So this was a mom who was attempting to manage all of this by herself. As a result, Amerigroup case management team worked to identify a provider that could have 2 registered behavior technicians in the home at all times, even during bedtime, which was a really challenging time for this member, to help mom reduce some of her stress. We were able to overcome challenges to secure the appropriate provider who could actually meet those needs of having 2 RBTs in the home around the clock. There was work focused on life skills, and the member was actually able, after time at home with the 24-hour ABA support, to get a job at Dollar General. He was also able to go back to school. He was able to ride the bus by himself, all things which seemed impossible when he first came across Amerigroup services. Some of the equity that we ensured was making sure that mom didn't feel unsupported and she had what she needed by having the RBTs in the home until she was able to manage the member's needs on her own. There were monthly meetings ensured to integrate delivery and continuous evaluation. And there was collaboration on the member's Social Security benefits because he was 16, he was getting older, and very soon would no longer be eligible for some of the Medicaid benefits he was receiving. There was also job training, there was respite care provided to mom, and support around group living plans for what he would do when he became an adult. We look forward to hearing questions from you about ABA, but for now, I will turn it over to Maria.
Thank you, Lakeisha. I'm back again. We're going to talk about value-added benefits. As you will hear me mention them, VABs for short. So value-added benefits are those extra benefits that are designed to improve our members' well-being. We encourage them to use some of their healthcare benefits while addressing some of the needs that they have while improving their health outcomes. So again, those are those extra benefits that we have available for members to ensure that we're covering some of the social needs. I have divided the benefits on categories, and I won't name them all because there are a lot, but I will highlight a few. All of our value-added benefits are available in our website, and they're also available in our materials in our table today. So for children, We have a lot of good benefits to ensure that they're staying active and healthy. So we have DoorDash gift card for the summer months. As we know, they're out of school, so we offer that gift card to ensure that they're having some meals at home. We have our new youth club membership card. It's a $100 card that the member can use to pay towards Boys and Girls Club, Girl Scout, Boy Scouts, or any after-school program that is available in their area. We do know that there's some Girl Scout troops or clubs that are not in all rural counties, but they may be an after-school program running by the local school or the rec center, so the card is available for those locations as well. We want to encourage our members to read, so we have a summer reading program where they can get either books at Barnes & Noble online or in the actual store. And we have an oral care essential kit for members 6 to 17 to ensure that they're completing their dental well check. For new and expecting moms, as we know, we have a lot of new moms in our program, or expecting moms. So we have our Mom-to-Be catalog, which is a catalog up to $100 where they can choose different items, and items that are essential while they're pregnant or having a baby. They can either go and choose 2 items or go and use all the amount, so it's available for them. We have a spa package for those moms after delivering the baby, and it's a $50 gift card that they can use for a facial, a massage, or anything related for spa services with a completed postpartum visit. We also have up to $120 in gift cards when they go and complete wellness visits or immunizations. This is to ensure that we are meeting those measures and heating measures that are very important for our quality. We have baby food, breast pump, diapers, strollers, and potty training seat. Of course, the member has to meet all those criteria. We have a first birthday gift for those members turning 1. We love this benefit, and you won't believe how many moms we have that are expecting, and then they have their baby, they become Amerigroup members, and then they get their 1-year benefit, and they send us photos, are excited to share that with us. And Sam's Club membership, that's one of the popular ones. Our moms love Sam's Club, where they can get items for the house. We have a healthy lifestyle. I'm excited to talk about our new OTC card. This is an enhanced benefit from last year. We now have OTC available via a card, and the member can request their card via a phone number or online. The card has $20 per month. If they don't use it all in 1 month, it rolls over, and they can use it the next time, so they don't necessarily have to use the $20, but they can buy a lot of approved OTC items, so vitamins, feminine items, ibuprofen, even vitamins, even Band-Aids, anything you can think of that is an OTC item. So we have the card available for our Georgia Family members and also for our Georgia Family 360 members. Of course, we want to ensure that they're staying healthy, as I mentioned, so we have Weight Watchers and gym. We also have pest control and hypoallergenic pillow for members with asthma. We have a home meal delivery benefit for members with diabetes. We have a cooking at home catalog where they can choose items from the catalog. The favorite item to choose is their air fryer, as you can think of. They love to choose that from that catalog. And then we have a voucher that is specifically for heating bills, power, and water. And that voucher, it's available during the different seasons for summer and winter. So right now, it just opened up for members to request. And then lastly, invest in your future. We want to ensure that our members who are going through school or they're graduating or finding a job, including Georgia Pathway members, have benefits available. So we have a $35 identification assistance. These $35 can be used for if they need to renew their driver's license or get a birth certificate, any that is a state benefit. We cover, of course, the GED exams. We have oil change, gas cards for our students. We have Chromebooks and college application fee that we cover for seniors in high school. And we have a community resource link that we love. It's a link that you can go and find resources in the community based on your zip code. So it's a great benefit available in the website. And it's not only for Amerigroup members, the community resource link is open to everyone. And then for Pathway members, we have an industry certification if they do need a specific certification for the job they have or the one that they're looking for to ensure they're meeting their qualifying activities. Or we also have an employment flex fund if they need to maybe get a new laptop or get something fixed in order to meet that qualifying activity. All of our value-added benefits can be requested by our website. We have a specific link there, or they can call member services, and they will help them at any time. If you want more details, again, they're located in the website, and we also have materials today in our table. How do we choose value-added benefits? Typically, we look at these 4 different categories. As I mentioned, quality, it's very important. If we want to ensure that they're meeting some of these quality measures, going to the doctors when they're supposed to, taking care of their prenatal and postpartum care, we take that in consideration. Also, any health plan initiatives that we have going on, we use that as well. SDOH needs. If we see that members are having issues with transportation or maybe food insecurity, we take a look at that. And then, of course, member feedback or community partners or providers like you guys. If we have feedback regarding a benefit that maybe we can enhance or we can change, we definitely, of course, take that in consideration. We have a monthly tracking of our utilization. We kind of look at what are the VABs that are more popular, what are the ones that maybe we can enhance, or the ones that members are not really utilizing. We review this on a monthly basis, and we share with our health plan so everybody is aware. These are some of the high performance and the low performance, as I mentioned. So high performance, oral care is one of those, which is great. That means that they are going to the dentist because they do have to have a dental checkup for that. The youth club, as you can imagine, is one of the high performance. The pillow and the seasonal utility, that is because we do have a lot of members that are asthmatic or with diabetes. And the mom-to-be catalog, which also makes sense because we have a lot of expecting members. And then the low performers are the ones that are less utilized. And I will say that it's also because the criteria for these ones are a smaller population. For example, the Chromebooks and the GOS card are for students. So we don't have probably as many students as we have pregnant moms. So Chromebooks, GOS card, identification, transportation, and booster seat. Those are the ones that are kind of low utilized. We want to always ensure that we're promoting them, so please ensure also that you inform Amerigroup members that they do have these extra benefits available to them. This is an example of how do we use our feedback to come up with value-added benefits. So we have our HIAC meetings, which is our member advisory committee. We meet on a quarterly basis. During those meetings, members are there to provide feedback or just ask questions. So in one of our member advisories, we had a mom who said, okay, great, you know, my kids are in school and they can get meals there, but what about when they're off school? The summertime, how can you help me when they're at home? So we went back, we took that feedback, and we came up with a DoorDash benefit. So things like that that we know might work across the state. Another feedback was postpartum care. The mom said, well, great, you have a lot of benefits we're expecting, which we do. But then they say, what about after I have my baby? I want to have some time for myself, or I want a benefit that rewards me. And then we say, well, that's great. We do need to work on our postpartum care. So we use that SPA package to promote moms going to the postpartum checkup. So that's how that came about as well. So again, any feedback that members give us, we try to take it in consideration and then enhance or come up with new benefits. And that's it for me. And I'll introduce Letitia Hope now. Thank you.
Thank you, Maria. I'm Letitia Halp. I'm the Compliance Director for Amerigroup, and I'm going to touch a little bit on the One Big Beautiful Bill and Rural Health Transformation. So the One Big Beautiful Bill introduces major Medicaid and rural health reforms, as Stuart mentioned earlier. And we as Amerigroup are aligning our systems and partnerships and outreach to meet new compliance requirements while maintaining member access and providing provider stability. Some of the key provisions of the One Big Beautiful Bill that would impact managed care would be the work community engagement. Adults 19 to 64 must complete 80 hours a month of work qualifying activities. The semi-annual eligibility redeterminations. So the states must redetermine eligibility for adults every 6 months, starting in Q1 2027. And retroactive coverage. Retroactive coverage is limited to 1 month for our Pathways members and 2 months for regular Medicaid. For rural health transformation, this is just a timeline of what we can expect. As Stuart mentioned, the application was submitted to CMS on November 5th. On December 31st, we can expect a decision from CMS from those applications, and then the deadline for enacting proposed policy is December 31st of 2027. The strategic goals of the rural health transformation include the following. Making rural America healthy again by improving health and wellness in rural communities through innovation and expanded access points. Sustainable access to rural health by improving operational efficiencies and financial stability through coordinated partnerships. Rural health workforce development will attract and retain a skilled, mission-driven healthcare workforce in rural communities. Innovative care models, which spark the growth of innovative care models that improve outcomes and strength coordination across providers. And technology and digital innovation, which foster adoption of innovative technologies to improve efficiency, data, security, and access to care. At Amerigroup, these are some of the ways that we would like to support the department in closing those gaps with the rural health transformation through population health infrastructure initiatives, expanding easy local access to primary care, behavioral health, and preventive services in community settings, through rural health network initiatives by helping rural providers form or expand integrated networks and improve delivery, coordination, and outcomes, through rural health regional excellence initiatives by forming affiliations with high quality regional systems and perinatal collaboratives, rural talent recruitment initiatives by developing, recruiting, and retaining long-term rural workforce, and value-based care initiatives by helping rural providers enter advanced value-based care and deliver proactive, preventative, and coordinated care. And then promoting care service initiatives by scaling, promoting digital care to prevent and manage chronic disease. So with that, I'm going to turn it over to Abby to talk a little bit about Georgia Families 360.
Good morning. I understand the weight that I carry standing between us and lunch, so I will not go in detail on a lot of stuff today, but just wanted to give y'all a high-level overview of some things we have going on with the GF 360 program, which that's our program that serves our kids in foster care, adoption assistance, and our Department of Juvenile Justice kids that reside in the community. So some highlights for you all today specifically. Just wanted to remind you that we do have the Care 360 platform. This is available via Availity, and this allows you to go on and get really a more holistic overview of the members that are being served. So it gives you access to everything from treatment history, prescription history, you can see their ID card on there, and then as you'll hear me say at the end, you can see who their care coordinator is, because all of our members do have an assigned care coordinator. So if you ever have specific questions about care, coordination of services, you can go onto that link and just kind of understand what's gone on with the member and then who you can talk to ensure that we're really having a collaborative approach to serving our children. The next thing I wanted to remind you all on, and this is, we're kind of doing a re-emphasis and relaunch, is the platform, and Lakeisha spoke to this earlier, but it's a concierge care platform. It's a texting process, and it allows our caregivers to get prescriptive text, but also engaging text to help support them in some various categories. So you'll see them on the screen, but we're specifically launching this with our transition age youth. So this is our 18 to 26 population, our caregivers of children with autism, and then we're launching a new program called Embracing Families, and this is for our families that maybe are at risk of child welfare involvement and just allows them to have more support to be able to do what they need to do to care for their families. So that is launching. If you're working with members and you think they could benefit from this, then just encourage them. They can reach out to us directly. They may already get a text about it, but we really just want to, we see this as a benefit, so we want to work together to raise awareness about this resource. And then lastly, like I said, every child in GF360 has a licensed clinician assigned, so you can find their information by going on the website on the screen, or you can reach out to really anyone at Amerigroup, and we can make sure that we connect you all accordingly. And then I would be remiss if I didn't shout out, we had an education and training department. So this is comprised of clinicians, non-clinicians who know a lot about a lot of stuff, and they're available for anyone to engage with. If you have specific trainings, you want information, even if it's not specific to Amerigroup, but it's about a diagnosis or authorizations or something along those lines, you can reach out to them and we can work with you all to make sure that we can train your staff or connect you with some ongoing trainings that we have in the community. So if you want to be on that listserv to hear about what we're training on, some are virtual, some are in the community. The email's on the slide, so feel free to reach out to that email and we'll add you to the listserv so you can stay abreast of what's going on. And that is all we have for today, so I think we're opening it up for questions now. Thank you.
Hello, everyone. We'll start with the questions. If you have any questions, please raise your hand and I'll come over to you. Any questions for Amerigroup? Okay. We'll start in the back.
Hi. I have not heard this personally, but somebody had mentioned to me that Amerigroup is not letting CFY, speech therapists, treat patients at the time. Is that correct?
Will you repeat the question? Probably speak up because it's pretty loud in the back.
Yeah. A speech therapist during their first year is considered a CFY, a clinical fellow. They have to be signed off on by a supervisor, but in the past, everybody's allowed a CF to treat. We've heard that Amerigroup is not allowing this anymore, or they're not going to be allowing it. Does anybody know?
I can bring it back to you if you need it.
Good morning. I'll take that question back and then I'll try to connect with you and we'll provide the answer to you. Thank you.
Okay. Thank you. All right, I'll take the next person right here. Here you go.
Good morning. So my question is related to the value-added benefits. So do the foster families have access to the value-added benefits? Because we will find sometimes for the over-the-counter medications, we get a lot of pushback. We can't afford it. We can't pay for it. So just wanted to know if they have access to those benefits as well.
So value-added benefits are for all Amerigroup members. Georgia Family 360 members actually have additional benefits that were not in the slide. So we do have additional benefits for them, and I can show you those. They're in the website. We do have a specific page for GF360, so you can also see them there. So on top of what I shared today, they also have additional benefits. OTC being one of them. And for 360 members, the OTC, it's the value, it's per member. For the Georgia families, it's per household. So we do have that benefit available.
Hello. I'm a psychologist and I do a lot of psychological testing pre-authorizations, and I wanted to know if there's going to be any changes to how those pre-authorizations are made currently through Availity.
So that's a great question, something we continue to assess. As those changes are made, we'll make sure that we share those in provider blasts or notifications out too. But as of today, the process that you do now of going to availability to submit the request is still in play, and we will let you know if there are any changes that are made.
Next question.
Okay. I know there has been some upcoming changes, or there are some upcoming changes in legislation, and I just wanted to confirm, like, should case management agencies have anything to expect when it comes to billing procedures and prior authorizations with the CMOs like Amerigroup, Peach State, and CareSource that we should know? Because from what I understand, all of these billing procedures and reimbursement rates and updates for everything is just pertaining to like direct service providers. But I just want to know what we should expect on the care management side.
So for Amerigroup, any changes that we make to our prior authorization process, you will receive notification at least 60 days in advance of that change. And so we will make sure that we will share those changes with you, but there are no current changes that you should anticipate at this time. If anything, we're really trying to find even more ways to make prior authorization less burdensome for you and for us as well. So.
Thank you for recognizing me. Brooke Terrell, founder and CEO at TherapyWorks. We provide comprehensive speech, occupational, and physical therapy services. And within the past year, we have experienced significant delays with credentialing providers. Is there anyone that can speak to any changes that may have resulted in this?
So that is a question we'll take back for our contracting team. So I'll follow up with you after this meeting. And also, I would suggest stopping by our claims table as well, but I'll also get your information and follow up directly.
In regards to the kind of in follow-up to her question about the credentialing, we never receive notifications when a provider is credentialed. So we basically just fly by the seat of our pants and submit claims and wait and see if the provider's claim is paid or if the provider is still considered not in network. I just recently reached out to my provider rep and asked the simple question, is this provider par yet? And she made me submit it through that platform. I've been waiting for 3 weeks for an answer for a simple question, is my provider par yet? And I still have no response. And so how are we supposed to find out if a provider is par yet? What platform should we be using? PAR is participating.
Okay, participating.
And that's what I was going to ask as well. With the credentialing, are you meaning contracted with Amerigroup to confirm whether the provider is par or non-par? Because
absolutely not.
Is
I'm
done
a
through DCH.
contracted agency and have therapists that I credential under my tax ID. And we go through the CVO process. They're CVO approved. We receive no notification from Amerigroup when they're loaded. I reach out to my provider reps, and so now what they're doing is saying you have to submit the question through that platform, and and rarely do we get a response. I still don't know if the provider is par, and it's been 3 weeks, 3.5 weeks.
And that's very frustrating. What I can do is connect with you and find out your information, but if you would like to request just some specifics, you could go to the claims table and they will provide that information to you. But have you received a notification welcome letter?
A notification what?
A welcome letter
Absolutely.
for those providers?
Never do.
Okay.
And
okay, if we can.
Also, how should we, if a provider rep can't answer that question, how are we supposed to find out when a provider is added to our contract?
So we discussed earlier, there's changes that are taking place and that have taken place within Amerigroup. And as changes come along, we come into some roadblocks, some things that work and some things that we've identified that just does not work. So that's one of those things that we're looking at in an in-depth form to identify ways that we could do additional outreach to the providers Again, our vendor table with our provider reps out there, you could pose that question to them, and if it's more so claims related, we could answer those questions at the claims table.
No, it's not claims related. It's, is my provider participating?
Yes.
I will get you to get started. Okay.
So it is 8 after, 11:38, 38 after, so we wanted to wrap up
Yeah,
the
one more
questions.
question. Oh, you want? Okay, so that'll wrap it up, and you guys enjoy lunch, and we'll see you when you return. Thank you. Please give the surveys to the ladies at the door. Thank you. I'm sorry. So they would like to do a giveaway if you guys have an extra couple minutes.
Maybe let's just tell them to visit the table.
Okay.
And we'll wrap it up in the next session.
Okay, and they say you can also visit the table for the gifts, the raffle tickets. Okay, so please visit Amerigroup. Thank you.